Take our seats. Thank you for your hands. And we're just going to do the protocol seating here at the high table.
Professor David, please take your seat next to the minister. Mwandishi wa habari, jukwaa la kuzungumzia litakuwa lile kule. Naomba tukajipange tafadhali. Samahani kama mliniona mimi niko hapa basi mkajiandaa hapa. So just a quick minute.
Tuna kiti kimoja hapa. Professor Abel Makubi, we have an empty chair for you. All right, I think we can get underway. My name is Taji, honored to be the MC for the launch of the Lancet Oncology Commission report on cancer control in sub-Saharan Africa. As you can see on the banner, our theme says an Africa-centric report that offers solutions to barriers that hinder cancer control in sub-Saharan Africa. So welcome, distinguished ladies and gentlemen. I'd like to present to you the Honorable Umi Ali Mwalim, the Minister for Health, United Republic of Tanzania, with your hands once again as our guest of honor. We also have her counterpart from Zanzibar, the Honorable Minister of Health, Honorable Nasor Ahmed Mazrui. Please acknowledge with your hands, ladies and gentlemen. We're honored to have excellencies representing their missions in Tanzania. Your Excellency Freddie Mwesigye, may you please rise so we may acknowledge your presence. And the Rwandan Embassy, from the Rwandan Embassy, Major General Charles Karamba, may you please also rise. Please, if I do not complete the protocol list, as there are so many dignitaries in the house, I believe others speaking at the high table will come
to complement my efforts. Mr. Abdul Malik, representing the Regional Commissioner of Dar es Salaam.
The Honorable Deputy Minister, Tamisemi, Local Government.
Professor Uganda, please acknowledge your presence. Professor Abel Makubi just joined the high table, the Permanent Secretary within the Ministry.
We also have the Chief Medical Officer, Dr. Ifelo Sichwale. Please acknowledge the presence. And the RMO, Dr. Rashid Mfaume, and the Dar es Salaam Regional Health Team. Please, could you all rise? Everyone from the Dar es Salaam, from the region health team, please rise with the RMO. Thank you very much, appreciate it. And most significantly today, I'd like to present to you Professor David Collingridge, who's the editor-in-chief, the Lancet Oncology. Please put your hands together for the good professor. And the commissioners, Professor Will Ngwa, the chair of the Lancet Oncology Commission for Sub-Saharan Africa. And may I request the other commissioners to please rise as I acknowledge your presence in the room. Professor Stephen Avery, Professor Twalib Ngoma, Dr. Jerry Ndumbalo, and Dr. Mansau Ngoma. Please acknowledge the presence of our commissioners in the room. The WHO Country Office is represented by Dr. Alfonsina Nanai, who's representing the WHO Country Representative. Please acknowledge our presence in the room. Thank you very much. And most significantly, again, this morning at this launch, from the Ocean Road Hospital, the Ocean Road Team and Management, represented by Dr. Julius Mwaisalage. Please, could you rise? We have two sessions this morning. The first session begins with the officious opening and the And so let's begin immediately with greetings from the region. And Mwakilishi Mkuu wa Mkoa, please allow me to welcome you. Since you're close to me, no, but no, I think we're gonna, please use the other podium. I'm going to take you a little bit far away, but the media is set out there and it's best that we speak from there. Karibu sana. Ladies and gentlemen, your hands, please.
On behalf of Dar es Salaam Regional Commissioner's Office, I would like to welcome you all here. Yeah, let me lead what my boss ordered me to say. Honorable Umi Mwalimu, Member of Parliament, Minister of Health, Mainland, Honorable Nasser Ahmed Mazrui, Member of Parliament and the Minister of Health, Zanzibar, Dr. Togange, Deputy Minister of President Office, Regional Administration and Local Government, Honorable Ambassadors from the government of Uganda and Rwanda, Dr. Ifelo Chief Medical Officer, and my boss, Permanent Secretary and Minister of Health, Dr. Rashid Mfaume, Regional Medical Officer, Dar es Salaam, Mrs. Valeria Milinga, Program Manager, Non-Communicable Diseases, Managing Directors from all institutions of Tanzania, National Muhimbili Hospital, Ocean Road, namely KSMC, Benjamin William Mkapa, Bugando, Mtwara, Medical Officer in charge from all regional referral officers, Professor David Cullen, leader of the recent Oncology Commission, Professor Will Ngwa, editor of the Oncology Recent Report, Professor Twalib Ngoma, Tanzania Oncology Commissioners, the Holy Family of Oncology in Tanzania, Pharmaceutical Oncology Stakeholder Conference delegates, member of the press, local and international invited, distinguished guests, anawasalimu kwa jina la Jamhuri ya Muungano wa Tanzania. Excellency, ladies and gentlemen, protocol observed. First of all, it is my pleasure and thankful to God that we are all healthy and privileged to witness this an important event of the Oncology Recent Research Report conducted in sub-Saharan African countries, not only to citizens of the Dar es Salaam region, but also sub-Saharan countries. Secondly, allow me to welcome you all guests officially to Dar es Salaam region in Tanzania to participate actively in sharing experience and make a contribution in all aspects in order to prevent our people from getting cancer disease by making early diagnosis and providing proper management based on standard quality of care that will finally reduce the burden and the mortality of cancer. I register my sincere thanks and appreciations to all local and international organizers, coordinators, and the teams that makes this event to occur as it planned to be in Dar es Salaam. It can be elsewhere. As we are talking in Dar es Salaam region, in collaboration with the stakeholder, just me, mention few Tanzanian Comprehensive Cancer Project, MDH, and the Maria Stopsy, we have started some initiative for sometimes for cervical and breast cancer screening, and also by training healthcare providers, community health workers, equip some of our primary healthcare facilities. The region started to experience an increase in number of early diagnosed cervical lesions and the confirmed cervical cancer cases 2019 to date. I wholeheartedly appreciate the sixth-phase government of the United Republic of Tanzania led by Excellence Samia Suluhu Hassan for significant investment at Ocean Road Cancer Institute, and it is a medical tourism cancer. That means patients come from various countries for treatment in Tanzania, especially Ocean Road. The region is still looking forward to have more collaboration with the interested stakeholders to increase the accessibility of services to client, community sensitization, and the capacity building to healthcare workers. Honorable guest of honor, hoping that the end of this event, the Dar es Salaam team will learn more through experience from experts in different countries so that we can increase and improve more in implementation of providing quality management of treatment to our people. Ladies and gentlemen, finally, I would like to welcome all again in Dar es Salaam and be free and enjoy while you are in Dar es Salaam. Thank you very much.
And we thank you very much, Mr. Abdul Maulid, representing the Regional Commissioner, for your kind words and welcome remarks. May I please now request Professor David Collingridge, please take the podium. And ladies and gentlemen, let's put our hands together. It should be a good listen to the good professor. Karibu sana.
Well, good morning. Dear Honourable Minister, Excellencies, distinguished colleagues and friends. It's with great pleasure that I stand here today and welcome you to this review of the Lancet Oncology's Commission on Cancer Control in Sub-Saharan Africa. Following many years of discussion and increasing concern in multiple academic fora, this project formally started in June 2019. It started as a holistic exercise to take a view of the cancer challenges facing the African continent as non-communicable diseases start to overwhelm healthcare systems. As you are all well aware, Sub-Saharan Africa comprises 46 countries and a total population of exceeding 1.1 billion people. This continent has long suffered high morbidity and mortality, driven by infectious diseases, malnutrition and poor maternal and child health. But it's also now been afflicted by a growing instance of cancer, a disease that high-income countries see affecting 1 in 2 people. This double burden of disease is a consequence of lifestyle and behavioural changes, a shift in population demographics to an ageing population. Etiology is caused by globalisation, genetics, infection, and environmental factors. The health of people in this part of the world, where fragile health systems are under-resourced, under-financed, understaffed, needs to be of global concern. Cancer incidence in Sub-Saharan Africa is estimated to have doubled over the past 30 years. And without effective interventions, the number of cancer deaths in this region is expected to exceed more than 1 million people per year by 2030. In May this year, the Lancet Oncology published a commission, 2 research articles, and a series of commentaries on cancer control in sub-Saharan Africa. They highlighted the region's rapidly rising cancer burden, the major challenges that exist, and the key actions that need to be taken urgently to address this escalating emergency. In this morning's symposium, you will hear from commissioners who oversaw this project, which included more than 50 renowned international experts, most of whom are from African nations. You'll have the opportunity to question these experts about the cancer epidemic we face and the solutions they have proposed in this comprehensive report. A number of recommendations for actions that should be prioritised and implemented as a matter of urgency, including establishing and maintaining robust cancer registries, creating effective cancer control plans, incorporating cancer care into universal health coverage, early cancer screening and detection, incorporating palliative care into the cancer care pathway, building and training oncology workforces, boosting cancer research, and increasing the use of telemedicine and other new technologies. Further, this report emphasises the need for and the importance of implementation research to improve the clinical care pathways and enhance service delivery. And finally, in terms of financing, the Commissioners suggest that funding should initially be prioritised for the most cost-effective treatments, such as vaccines for preventable cancers and more affordable treatments that deliver the best and greatest clinical cost-benefit ratio. And they recommend that transparent and dedicated revenue streams should be established, with the input from international collaborators as needed to finance these specific cancer control measures. Now, although every nation will need to adapt these recommendations to best suit their own specific situations, with political determination and coordinated approach across the continent, improved cancer care is achievable. As the quote on the booklet that you have in front of you says, "We have seen too many reports, too many words, too many good intentions, too many families torn apart, and too many excruciatingly painful deaths to see yet more delays in taking collective action." I'd like to thank you all again for attending today and for the opportunity for us all to be here. The time for action is now. Thank you.
All right, the time for action is? It definitely is now. Professor, you're sharing the stage with Professor Ugonjwa. Ladies and gentlemen, please put your hands together. Professor, once you're done, I'd like to know where you got that shirt. Might use it for one of my events. But you have a message from the White House and then your own remarks. Karibu sana.
Good morning. We're really happy that you're here today. Honorable Minister, I want to just first of all extend gratitude to the government of Tanzania. And we invited you in July to come to the United States, but you sent the excellent Ambassador Cancer to represent you. And coming out of that, she said, you know, this is actually the 4th event that we're launching. And she said, you have to come to Tanzania. Initially, we were thinking about other countries, but thank you for, you know, making that advocacy to be here today. And I think it was a good choice because East Africa actually turns out to be one of the regions where the cancer burden really needs urgent action. And so it's really important that we can do that here in Tanzania. I want to mention that in the United States, the White House is very committed to partnering with African countries. And I think that, you know, Honorable Minister and the government is this step today is a good step towards that kind of engagement, to position Tanzania as one of the countries where that partnership can really happen. And so I'm going to introduce to you a talk from the White House, a short video presentation from the White House, just to kind of express that commitment to what we are doing here today. Please go ahead.
It is an honor to be able to provide a few remarks for you today on this very special occasion of the East African launch of the Lancet Oncology Commission on Cancer in Sub-Saharan Africa. And I would like to extend my deepest gratitude to Ambassador Konza for extending this invitation and including me in such an important occasion. It is especially exciting to me to be before you today because I am someone who, for the first 18 years of my life, grew up in Sub-Saharan Africa, and through the twists and turns of my life, am now being reconnected to it in my capacity of serving as the White House Office of Science and Technology Policy Assistant Director for the Cancer Moonshot. The Cancer Moonshot, for those of you who may not be familiar with its mission, in the United States and throughout the global cancer community, responded with passion, ingenuity, and commitment. The work he led in the final year of the Obama-Biden administration led to the launch of new programs, policies, and collaborations from all sectors, actions that address the patient experience from diagnosis through survivorship. Importantly, it also led to major global collaborations, like that of the International Cancer Proteogenome Consortium at the National Cancer Institute. It now spans 14 countries with 33 member institutions, a network of leading cancer and proteogenomic research centers across the globe that represent the diversity of people and of cancers around the world. This consortium encourages cooperation and investments in cancer research and data dissemination with its pledge to share data between all participating entities, critical elements towards accelerating innovation and new treatments that we know need to be supported and scaled in Sub-Saharan Africa. When now President Biden returned to office, he wanted to supercharge the work and bring his leadership and the whole of government effort back to the Cancer Moonshot. That's why in February, President Biden reignited the Cancer Moonshot to transform hope into action and set new goals: to decrease the death rate by cancer by at least 50% over the next 25 years, and to improve the experience of people, their families, and caregivers living through and surviving cancer. In addition to setting new goals to better care for patients and loved ones and to decrease the cancer death rate, the President identified areas of priority focus. He has said often that he wants to end cancer as we know it. We took that statement and defined specifically how we know cancer today. Too often, a patient receives a cancer diagnosis too late. We have too few tools or do too little to prevent cancer. We have stark inequities in diagnosis, access to treatments, and trials. We know too little about how to target treatments to patients. We know that there are cancers which lack good strategies to develop treatments, like the deadliest diagnoses, rare and childhood cancers. We leave most patients and caregivers to navigate the disease and its aftermath, including survivorship, on their own. And we don't learn enough from patients. But these challenges are not unique to the United States. Certainly, we share them with many countries across the world. And so the urgency to address them is paramount. We know that in Sub-Saharan Africa, with a population exceeding 1.1 billion people, that without effective interventions, the number of deaths from cancer will exceed 1 million per year by the year 2030. This is not news to you, but this is unacceptable. To see real change happen, we must come together as one to tackle some of the greatest and shared priorities together. Our ability to strengthen international collaboration around key oncology elements like clinical trials, data sharing, and basic and translational research will accelerate new and innovative treatments for all cancer patients. Working across international boundaries also means sharing best clinical and care practices, new ideas, and reaching more people with effective ways to prevent, detect, and treat cancer and lessen the toll on human life. Many barriers remain, but there is no doubt that the future of oncology lies with global collaboration. Building strong partnerships and cooperation between countries like the United States and countries in sub-Saharan Africa are key to overcoming them. And so I'd like to end where President Biden and the First Lady so often start, with hope. I don't have to tell this crowd that we don't mean hope in the abstract. We mean hope grounded in science, hope grounded in quality care, hope grounded in keeping families together, hope represented by every survivor around the world. And I'd also like to add hope provided by the eminent group of 54 internationally renowned oncologists, cancer researchers, health policy experts, and nurses across Africa, including Tanzania, who worked on this major commission by the Lancet Oncology. On ending cancer as we know it. You have our commitment to make significant progress together. Thank you so much for your time and this opportunity to be before you today.
We thank Dr. Catherine Young for those remarks. I will just make two more statements and then I'll leave. One is that, like you heard in her statement, they say that the future is really in international collaborations. And so in December, President Biden is going to be hosting the US-Africa Summit, where they've invited all African presidents to Washington, D.C. And one of the things that's going to be on the agenda is going to be healthcare. If you've listened to President Biden, there's no time he talks without saying cancer. He's always talking about cancer. He and Dr. Jill Biden are very passionate about it. And so this creates a very good opportunity for collaboration. Including US-Tanzania collaborations to address this. Like the African saying says, you know, if you collaborate, cancer actually killed more people last year in Africa than COVID-19. Okay, so the same urgency that was poured into COVID-19 should be considered for cancer. Like David said, the time for action is now. Thank you.
Thank you, Professor, for your good message, Professor Ugonjwa. Ladies and gentlemen, it's now my great pleasure to welcome the WHO country representative, country rep, Dr. Alfonsina Nanai. With your hands, ladies and gentlemen, karibu sana.
Thank you. As introduced, I'm Dr. Nanai from World Health Organization. Kazi for Tanzania. Honorable Umi Mwalimu, Minister of Health Tanzania Mainland, and Honorable Nasor Ahmed Mazrui, Minister of Health Zanzibar, and Honorable Festo Dugange, Deputy Minister, President's Office, Local Government, and others who are here. I wouldn't mention by names. And wish to recognize also the presence of other ministers if they're here in this meeting. Honorable Ambassador of the Government of the United States, if he's here, and other representatives who just presented here in front of us. Permanent secretaries, start with the Permanent Secretary, Ministry of Health, Professor Abel Makubi, and other permanent secretaries if they're here. Chief Medical Officer, Ministry of Health, Directors and Assistant Directors, Regional Medical Officers and the regional team and district teams, Managing Directors from different institutions. We had Ocean Road, Muhimbili, and many others who are here. My colleagues, doctors, and other staff around, and representatives from development partners and implementing partners, without forgetting the Lancet Oncology Commission from the leader, editor, and others who are here. But we also have experts from the Oncology Commission itself in Tanzania, Professor Ngoma and others who are here, members of the local and international press, invited guests, ladies and gentlemen, all protocols observed. Good morning. First and foremost, we would like to thank the government of the United Republic of Tanzania for providing us with another opportunity to participate and provide remarks at this important event on non-communicable diseases. We would like to express our sincere gratitude to the Lancet Oncology Commission for undertaking a thorough assessment of cancer situation in sub-Saharan Africa, the results of which will inform career-related actions and policy decisions. Importantly, we recommend the research team, which we know it included experts from the region as well as WHO, for coming up with these recommended key actions. We had a few of them here, and the shared case studies and successful models that can be replicated, adapted, or enhanced throughout the region to combat the growing cancer crisis. Truly, the composition of this research team that we had, which include eminent researchers from the region, will ensure context-specific perspectives have been factored in the synthesis and recommendations as we go on addressing cancer in Tanzania. Now, ladies and gentlemen, I wouldn't repeat what others have said, but so far, cancer is a leading cause of death worldwide, and it's accounting for nearly 10 million deaths in 2020 alone, which is nearly 1 in every 6 deaths we had. The most common cancers, I hope we all know, breast, lung, colon, rectum, and prostate, are all in Africa and in many other countries. Countries in the African region bear the highest burden of cervical cancer as we speak, and it's exacerbating regional disparities in access to prevention, detection, treatment, and care. In addition, the burden of cancer risk factors are increasing, with around 1/3 of cancer-related deaths attributed to cigarette, high body mass index, alcohol consumption, inadequate fruit consumption, lack of physical activity, and many other reasons. But we can also say that we see approximately 30% of cancer cases now diagnosed in our low and middle income countries are a result of infections such as human papillomavirus and hepatitis and others. Ladies and gentlemen, there are news with this one. Between 30 and 50% of cancers can currently be prevented, but we can prevent them in different ways. One is by avoiding the risk factors and applying the proven prevention techniques which are published in this report, but also early detection of cancer and appropriate treatment and care can help reduce the burden that people suffer from this condition. And also, we all know that we need to diagnose correctly so that we treat appropriately. Our worry here is the disparity that we have between developed countries and those developing, such as Tanzania. We can see that what is available, above 90% of what can be done is in developed countries. And in countries like ours, it's only 15% of what is available to be given to people who need care that we have. World Health Assembly has done a lot of actions with a resolution which was passed in 2017, but also we have many other global strategies for breast, for cervical, childhood cancers that we are working on and working together with other partners. This publication, therefore, is coming at a period when a lot of global attention is focused on NCDs, including cancer, and we believe that we can see a change and address what is really happening. We take this opportunity, Madam Minister, to commend Tanzania for what is being done and for allowing this meeting to take place that is part of an advocacy to what is happening. And together with the International Agency for Research, where WHO works closely with, other UN organizations, the International Atomic Energy Agency, and many others, we wish to reiterate our commitment to supporting and working with the government of the United Republic of Tanzania, as well as WHO in other country offices and global and regional, to bring the technical assistance required and leadership to support cancer prevention and control, and especially through supporting the implementation of the recommended actions in this publication. And we hope to reduce this growing cancer crisis in sub-Saharan Africa. And we believe that the political commitments set, as well as sustainable development goals set, will be reached if we all work together. With these few remarks, I wish to say thank you all for listening.
Honorable Nanai, we thank you very much for your remarks and the continued commitment. All right, thank you. So we'll continue now, and in mentioning the regional efforts, we are honored to have two excellencies in the House that we will afford an opportunity to make remarks. Ladies and gentlemen, let's begin with, from the Rwandan Embassy, Your Excellency Major General Charles Karamba. May we welcome you for your remarks. With your hands, ladies and gentlemen. And in turn, Your Excellency Freddie Mwesigye from the Ugandan High Commission will also welcome you for your remarks before we move to the Permanent Secretary.
The Honorable Minister Umi Mwalimu, ministers present here, the experts, senior medical officials from the government of Tanzania present here, excellencies, ladies and gentlemen. I want to, I think, say just only one word, and it is to thank the government of Tanzania for affording us ambassadors, specifically ambassadors from the region, EAC region, to be present in this event. And our presence here indeed goes with the theme of collaboration. The word collaboration was mentioned, and the word awareness was mentioned. It is disheartening to learn that cancer has killed more people in the recent past than COVID. The resources and time that was given to COVID prevention, I think, needs to be refocused also on this cancer scourge. So that's the reason I say that talking about awareness, this is a very important thing. I think this information is not known to many people. It is important that in events like this, we share the information that we have and then be able to try and do what we can in as far as prevention of this scourge is concerned. And with that, once again, Honorable Minister, I take this opportunity to thank you for giving me this opportunity to be here. Thank you so much.
We thank you, Excellency Freddie Mwesigye. Karibu sana. With our hands, ladies and gentlemen.
Honorable Minister, the guest of honor, and all distinguished guests, ladies and gentlemen, I'm not going to protocols because they have already been reorganized. I join my colleague to extend our sincere gratitude for having been invited to this important conversation. And I want to assure you that we shall convey this report to our countries, and we shall share this report which we have received either in full or in summary to our colleagues who have not been able to make it here. But I also want to say that the two experts that have spoken from Lancet, or in the report I saw, the consequence of this double burden is due to lifestyle role. Tuko watumishi, we are vehicles of making things change. Now, as leaders, I think it is our of a burden or a challenge, then they can start thinking of finding solutions. So I would like us to, and I thank the government of Tanzania. Whenever I watch your radio, your TV, TBC1 is very, very good instrument for sensitizing the population. And I wish all the radio stations and television stations in the country copied that good example. So our role really is to make our people aware that there is this challenge, make our people would be available to them to explain even the lowest village person. So I want to promise that I will convey the message, but I also encourage our colleagues and our friends in our countries to make sure that we try our level best to make sure that this information reaches the population. Otherwise, I want to thank you for this opportunity, and I want to promise that our countries and my country, in Uganda in particular, we are partners in this struggle. Thank you very much, and God bless you.
Fantastic. We thank you, Your Excellencies, and we're truly encouraged by your willingness to continue cooperating in the fight. And now, as I welcome the Permanent Secretary, Ministry of Health, Professor Abel Makubi, sir, you may proceed. You also have the honor of welcoming the guest of honor for her speech. And we are preparing for the official launch at the table. And then we'll do a photo session, which I will organize in groups. You will come filing through behind the chairs of the dignitaries at the high table. But in the meantime, karibu sana, Professor Makubi. With our hands, ladies and gentlemen.
Thank you very much, Taji Liundi. Honorable Minister of Health, Honorable Umi Mwalimu, Honorable Minister for Health from Zanzibar, Honorable Mazui, Honorable Dr. Festa Lugange from the PORAG office, representing the Minister, Professor David, the head of the Lancet Oncology Commission, all members of the high table, all participants, invited guests, good morning. I would like to give thanks to the organizing committee for this event, for being able to put together all preparation ready for this meeting. Also, allow me to extend extend my appreciation to our Honorable Minister, Honorable Mwalimu, for accepting the invitation to come to this important meeting. Asante sana Mheshimiwa Waziri. Also, I would like to thank everybody for taking his time or her time and be able to travel and be able to attend this important gathering on a cancer control strategy through the report which is going to be launched from the Lancet Oncology Commission. I would also like to recognize the Lancet Oncology team for being able to travel all the way from the US and from other African countries to be able to attend this meeting. When I was reading the report on the Oncology Lancet Commission, I was very impressed to see that the report does not only call for actions, but also it has an excellent review on the state of cancer in sub-Saharan Africa. And this has been a major problem for us in Africa. We have been talking about cancer, but we don't have enough information on how the magnitude is. So through this report, at least now we're able to see how cancer is widespread in sub-Saharan Africa. So congratulations to the team for being able to undertake that task. But also the report goes into the details of giving the challenges that which we are facing in control of cancer in sub-Saharan Africa. And at the end, we have the 8 action plans which have been called for us in Africa to be able to adapt or implement. So on behalf of the government of Tanzania, I want again to really thank the Commission and for all our participants for being able to gather in Tanzania and for accepting our invitation to come to this event. And I hope after this event we shall be able to go and implement the 8 action plans which have been called by the Commission. So with these few remarks, I would like now to welcome Honorable Mwalimu, our Minister for Health, to speak to all this audience, but also to launch the report on the oncology, Lancet Oncology Commission. You are welcome, Honorable Minister.
Thank you very much, Professor Makubi. Honorable Nasoro Ahmed Mazrui, Minister of Health Zanzibar. Honorable Dr. Festo Dugange, Deputy Minister, President Office, Regional Administration and Local Government. Professor David Collins, Leader of Lancet Oncology Commission. Representative of Dar es Salaam Regional Commissioner, Professor Abel Makubi, Permanent Secretary, Minister of Health, WHO Representative Dr. Nanai, Chief Medical Officer Dr. Sichwale, Managing Directors, Heads of various institutions, including Muhimbili National Hospital, Ocean Road Cancer Institute, NIMRI, TFNC, Ifakara Healthy Institute, KSMC, Bugando Medical Hospital, Mbeya Zonal Hospital, Mtwara, Chato, all representative of various institutions. I would also like to acknowledge the presence of Professor Pembe, Chancellor, Vice Chancellor of Muhimbili University of Health and Allied Sciences, all representatives, honorable ambassadors from the government of Uganda and Rwanda, colleagues from non-governmental organizations, development partners, Professor Willy Ngwa, editor of the Oncology Lancet report, Professor Twali Bungoma, Tanzania Oncology Commissioner, the whole family of oncology in Tanzania and in East Africa, members of the media, invited guests, ladies and gentlemen, habari za asubuhi. First, let me start by thanking God for giving us good health and enabling us to travel safely to participate in this important gathering. In particular, I would like to express our deepest appreciation on behalf of Her Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, for the leadership of Lancet Oncology Commissioner's team to accept the invitation of launching this report in Tanzania on behalf of the East African country. Thank you very much, Lancet Oncology Commission, for accepting our invitation. And then when I received a letter from our representative in Washington, Balozi Kanza, that I attended this particular meeting on your behalf, I think it will be a good idea to invite Lancet Oncology Commissioners to come to Tanzania to launch the report for the East Africa. I didn't hesitate to write to you, to invite you to come, because as a country, we are, apart from being challenged by non-communicable, by infectious diseases, but the health sector in Tanzania actually has been overstretched by non-communicable diseases, including cancer, cardiovascular diseases, high blood pressure, and various non-communicable diseases. So I welcome you all to Tanzania, and I hope you are having a wonderful stay here in Tanzania. I would also like to thank all the coordinating teams from both in-country and outside the country for making this event a reality. Ladies and gentlemen, it is my pleasure to be with distinguished people like you who have big interest in cancer control in sub-Saharan Africa and globally. I'm inspired by the spirit and leadership of the management of Lancet Oncology, who created a thinking space and conducive atmosphere for the commissioners to work together to address forthcoming health crises anticipated if important measurable efforts are not kept in place. I would like to recognize the leadership of Lancet Oncology, especially Professor David Collins, all the commissioners, contributors, and the report editor, Professor Will Ngwa, for their tremendous work, and we welcome their key recommendations since they serve as an essential tool for policymakers across sub-Saharan Africa. The report is timely and crucial to address the rising incidence of cancer in sub-Saharan Africa and Tanzania in particular, where we are planning to review our national cancer control strategy of the year 2013-2022. So I'm very pleased that we are launching the report today, while we are planning also to review our national cancer control strategy. Ladies and gentlemen, I'm aware that the purpose of the Lancet Commission report on cancer control in sub-Saharan Africa is to address the rising incidence of cancers in our region. The key findings and the recommendation in the report will serve as a benchmark in evaluation of our national cancer control strategy and set a new action plan. The production of this report reflects a shared commitment to reducing the incidence of cancer and improving the quality of life of those who develop cancer, especially the most vulnerable. Ladies and gentlemen, it is now 50 years since the war on cancer was declared by the signing of the U.S. National Cancer Act of 1971 on December 23, 1971, by President Richard Nixon. It is over 40 years since the WHO started to advocate for countries to have national cancer plans in order to carry out national efforts to fight cancer more effectively. These efforts resulted in increased funding for cancer control in general and cancer research specifically. However, let us face it, most claimed success stories and breakthrough are not proving to advance therapies and outcome in sub-Saharan Africa significantly. In short, in spite of massive investment to fight cancer, we in sub-Saharan Africa still have tremendous disparities in accessing cancer services, especially diagnostic services, but also cancer drugs, and they do not have universal access to cancer services. A situation like this is not acceptable. For this reason, I support all of you who have a desire to improve a lot of cancer patients in sub-Saharan Africa, and most important, register our government unwavering support to the Lancet Commission for their efforts to address disparities in accessing cancer services. Ladies and gentlemen, according to the Lancet Oncology Report, which we are launching today, the number of cancer deaths per year in sub-Saharan Africa will double between 2020 and 2030, as it has been mentioned by Professor David Collins, to about 1 million deaths per year. I was basically looking my data for 2020. In Tanzania, we have over than 24,000 deaths due to cancer, which have been recorded last year. So, was it the ambassador? I think it was David who said, we are losing more people actually due to cancer rather than due to COVID. And look how much money we have invested on COVID-19. Kwa sababu since COVID-19 outbreak started in Tanzania, we recorded less than 1,000 deaths. But just 2020 in Tanzania, over 25,000. Is it 25,000 in my salary? Yes, over 26,000 deaths during the year 2020. Kwa Kiswahili, tangu tumerekodi vifo vya uviko 19, havijafika hata 1,000, lakini kwa mwaka 2020 Tanzania tuna vifo zaidi ya 25,000 mwaka mmoja tu ambavyo vimetokana na saratani. Kwa hiyo cancer is a very serious issue for the government of Tanzania, and unless rapid intervention are implemented, tutaendelea, we are going to lose quite a big number of our citizens. It is also important to note that 27% of all cancers in sub-Saharan Africa are those associated with infectious cervical cancer, human papilloma virus, HIV virus. East Africa in particular has the highest incidences of cervical and Kaposi's sarcoma compared to the rest of Africa. Much of these cancers are preventable by lifestyle modification, reducing environmental exposures, and early screening, diagnosis, and treatment. Indeed, it is estimated that 30 to 50% of all cancer deaths could be prevented if population screening and early diagnosis were addressed to ensure patients with curable cancers are treated early enough. Ladies and gentlemen, we take seriously the report recommendations, one being to develop or update national cancer control plans in each country and to make a substantial investment in developing cancer registries and cancer diagnostic for core cancer tests. I'm aware that most of the recommendation is under implementation process here in Tanzania or in plans to some of our countries. I would like to call upon development partners and other stakeholders to continue so as to substantially increase access to cancer care in Africa, accelerate cancer prevention and control efforts, increase survival, and save billions of US dollars over the next decades. Just to give you an example here in Tanzania, it has been actually scientifically proven that if we vaccinate our girls, David is also trying to convince me also to vaccinate boys, but we have HPV vaccine whereby we vaccinate girls in order to protect them from developing cervical cancer. And the vaccination exercise was launched in 2019, but due to misinformation, kwamba mnawapa watoto chanjo hii ya saratani ya mlango wa kizazi, mtawafanya wasije kuzaa, kwa hiyo chanjo ile mwamko wa wananchi ukapungua. So we are going to relaunch HPV vaccine program in Tanzania kwa sababu, thank you very much, kwa sababu we'll be able to save actually thousands of lives of women in Tanzania. My colleague, Ambassador from Rwanda, I'm looking for the name, Ambassador Charles, wenzetu Rwanda, they have vaccinated over 95% of girls in schools with HPV vaccine. I don't see why we should not vaccinate our girls here in Tanzania. So very soon we are going to relaunch another campaign to vaccinate girls aged 9 to 14 years in Tanzania in order to protect them from cervical cancers. According to Asian Road statistic, it is actually #1, the most common cancer in women here in Tanzania. Kwa ndio cancer ambayo inawaathiri wanawake wengi Tanzania, I think about 43%. 36% for all cancers. Thank you very much. That is one of the measures which we are going to employ in order to protect our girls or to protect women from developing cancer. But also we have made a very big decision within the Ministry of Health. We are also going to raise the profile of hepatitis disease. So we have decided we are going to relaunch, I don't know whether to relaunch or rebrand our National AIDS Control Program. It will also be responsible for hepatitis. So it will be called, sijajua jina, kwa hiyo hata mpango wetu wa kudhibiti ukimwi, tunaubadilisha jina, utakuwa ni mpango wa taifa wa kudhibiti ukimwi na homa ya ini. Kwa hiyo pia we are going to embark on screening services. We are going to embark to ensure that many Tanzanians have access to hepatitis vaccine, kwa sababu pia ni ugonjwa ambao tumeona unakuwa kwa kiasi kikubwa. We are doing very well in terms of people who are HIV positive know their HIV status. It is about 90%. Viral load suppression is over 95%. And I mean, people on drugs is over 95%. Viral load suppression is over 95%. So we thought we should also at least raise the profile of hepatitis diseases in Tanzania. So we are going to task our National AIDS Control Program to also be responsible for hepatitis control and prevention in Tanzania. So since tukiweza kucontrol pia hepatitis B, tutapunguza pia kesi za saratani ya ini kwa kiasi kikubwa. Another measures which we are going to employ is to enhance screening services, especially at the lower level for early detection. Very unfortunate that over 90% of people with cancers in Tanzania report to our hospitals while the disease is already at advanced stage. So I'm also aware that the Lancet Oncology report has also recommended for us to accelerate cancer prevention and control efforts, increase survival. increase survival cancers in Tanzania. So we do believe that if we focus on preventive efforts, control effort, increase survival, we'll be saving quite a number of money. I'm also optimistic that the international community will act to strengthen global health capacity so that community health system in sub-Saharan Africa will stand the increasing burden of cancer and other non-communicable diseases and reap the benefit of global cooperation to defeat this global challenge together. I would like to call upon all stakeholders from various areas such as governments, development partners, businesses, philanthropy to support our countries into developing strategic, sustainable investment to build robust and resilient primary healthcare services that could be accessed by every Tanzanian. Ladies and gentlemen, before concluding my speech, I would like to appeal to the international community to support our non-communicable disease control program because we do believe that once we focus on preventive control as well as improve curative services, we'll be able to save millions of lives of Tanzania. On behalf of the government of the United Republic of Tanzania, I would like once again to thank various stakeholders and partners in control of cancer disease for all the support that they are providing to improve healthcare for not to Tanzania only, but also to other sub-Saharan Africa. Once again, thank you very much, Lancet Oncology Commission, for accepting our invitation to come to Tanzania and launch the report for the East African region. And to me, as a minister responsible for health, as a mother and as a woman, cancer is a top priority because cancer is also a gender equality issue. I see cancer as a gender equality issue and as a women's right issue. Women as victims, but also as caretaker. Especially in Africa, I don't know about other countries, but here in Tanzania, if someone is sick with cancer, those responsible to take care of the sick persons are women. So it is actually a double burden for women in Tanzania, I think in the other East African countries. That's why I'm so much committed. I wasn't supposed to be here today, but then I had to travel all overnight in order to be here, just to, as a symbol, to symbolize my commitment to improve cancer services in Tanzania and East Africa as a region, especially to improve screening services for early detection as well as curative services. Baada ya kusema hayo, na washukuru sana. I would like now, finally I would like to acknowledge the role and importance of the media in our joint efforts to educate the public about cancer disease. With that said, I would like to officially announce that I'm now ready to launch the Lancet Oncology Commission report on cancer control in sub-Saharan Africa here in Dar es Salaam on behalf of the East African countries. Thank you very much for your kind attention. Na kwa haraka kwa vyombo vyetu vya habari ni kwamba tunazindua taarifa ya Lancet kuhusu hali ya saratani kwa nchi za kusini mwa Afrika. Okay, sawa. Kwa hiyo tunazindua taarifa ya Lancet ya hali ya saratani kwa nchi za kusini mwa jangwa la Afrika ambao wameifanya mwaka huu, na taarifa hii inagusa nchi 46. Kwa hiyo wamekubali mwaliko wetu wa kuja kuzindua taarifa hii kwa nchi za Afrika Mashariki katika nchi yetu ya Tanzania. Na kubwa katika hii taarifa imeonyesha kwamba mzigo wa saratani unazidi kukua kwa kiasi kikubwa katika nchi zetu. Tusipochukua hatua tunaweza pia kupata vifo takribani milioni 1 kwa mwaka ifikapo mwaka 2030. Na wametoa mapendekezo mbalimbali ambayo tunapaswa kuyatekeleza kama nchi za Afrika. Wameweka mapendekezo 8, nadhani wataalamu watawapitisha, lakini kubwa ni kuhakikisha kwamba tunapanga mipango mizuri ya kuweza kudhibiti saratani. Jambo la pili ni suala la takwimu, na hili kwa kweli na mimi nataka kulisisitiza sana kwamba wanasema pia tunahitaji kuimprove au tunahitaji kuboresha upatikanaji wa takwimu za hali ya saratani katika nchi yetu, lakini pia wametutoa ushauri wa kutengeneza mfumo mzuri wa kuhakikisha watu wanapata huduma bora za matibabu, equity of access, bila changamoto ya fedha. Wanasema tunatakiwa reduce out of pocket expenditure for essential therapies. Kwa hili ni jambo ambalo wamelipendekeza kwamba tuhakikishe pia tunaweka mfumo mzuri wa wagonjwa wa saratani ambao wanahitaji huduma kupata huduma bila ya kikwazo cha fedha. Lakini pia kuna masuala ya kuboresha tiba pamoja na huduma za tiba shufaa na kutengeneza pia kuwa na wataalamu wazuri wa kuweza kutoa huduma bora za saratani. Lakini pia wamependekeza katika masuala ya kuwekeza kwenye tafiti na ubunifu, na jingine ni katika masuala ya telehealth. Kwa hiyo tumewashukuru kwa taarifa hii, na mimi nimeeleza kwamba saratani ni janga kama WHO alivyosema pia katika nchi yetu, na tunapoteza Watanzania wengi ambao wanaugua saratani. Tukiangalia tu mwaka 2020 walifariki Watanzania zaidi ya 25,000 kwa mwaka, wakati uviko 19 tangu tumeanza hatuvizidi kuwa na vifo 1,000. Kwa kama serikali tunaendelea kutekeleza mikakati mbalimbali ya kupambana na ugonjwa huu, lakini kubwa ambalo nimeahidi ni kuhakikisha tunawekeza katika huduma za kinga, ambapo elimu kwa Watanzania kuhusu kujikinga na saratani, lakini saratani pia ya mlango wa kizazi tunaweza tukaidhibiti endapo pia tutatoa chanjo ya kuwakinga wasichana na saratani ya mlango wa kizazi. Chanjo hii tulizindua mwaka 2019, tukarudi chini kwa sababu ya hisia tetesi na maneno kwamba labda inaweza ikawafanya wasichana wasije kuzaa, lakini tunao ushahidi wa kisayansi. Tumetoa hiyo chanjo wakati ilipoanza kwa majaribio, na kuna hao wasichana waliopewa wamezaa. Kwa hiyo hauhusiani kabisa na masuala ya kuzuia wasichana kuzaa. Kwa hiyo nimeahidi kwamba tutazindua upya utoaji wa chanjo ya saratani ya mlango wa kizazi kwa wasichana wote wa umri wa miaka 9 mpaka 14 ili tuweze kuwakinga. Wenzetu Rwanda, Willy, is it 95% in Rwanda or 90% with HPV vaccine? 90. Wenzetu Rwanda wamewachanja. Tena Waziri Mazrui alikuwa ananiambia hivi, balozi, my fellow minister is challenging me. Rwanda is everything, yeah? It's a good example in everything. Kwa hiyo hata Waziri Mazrui alikuwa ananiambia Rwanda kila kitu. Kwa Rwanda wenzetu wamewachanja wasichana kwa 95%. Kwa na sisi tutatoa hiyo chanjo. Lakini jambo la pili ambalo nimesisitiza ni kukinga pia wananchi na maambukizi ya homa ya ini ambayo yanasababisha pia saratani ya ini. Kwa hiyo tumefanya maamuzi wizarani, mpango wa taifa wa kupambana na ukimwi tutaubadilisha jina na tumeupa majukumu, utakuwa ni mpango wa taifa wa kupambana na ukimwi, homa ya ini na magonjwa ya zinaa. Magonjwa ya ngono ya zinaa? Ni magonjwa ya zinaa au ya ngono? STIs, Zinaa ndo. Kwa hiyo mpango wa taifa wa kudhibiti ukimwi utaitwa mpango wa taifa wa kudhibiti ukimwi, magonjwa ya ngono na umesema zinaa? Hapana, ni ngono bwana. Tutalijadili vizuri. Zinaa ni kama kitu ambacho sio halali. Ngono ndio lugha rahisi. Ndio lugha sahihi, na magonjwa ya ngono sio zinaa. Sawa. Kwa hiyo naomba hii off record, si sawa? Ni magonjwa ya ngono. Zinaa isiwepo. Kwa sababu ukisema zinaa maana yake hata mke na mume, ile sio zinaa, sawa? Na kuna magonjwa yanaambukizwa kati ya mke na mume. Kwa hiyo ni magonjwa ya ngono. Kwa mpango wetu wa taifa kuelekea siku ya ukimwi duniani tarehe 1 Disemba tutazindua pia mpango mpya ambao utakuwa unakabiliana na magonjwa ya ukimwi, homa ya ini na magonjwa ya ngono. Lakini kubwa ni kuhakikisha tunaboresha pia huduma za matibabu. Nadhani nimewakava vizuri waandishi wa habari. Inatosha? Au maswali nje nikimaliza, sawa? Okay, so thank you very much, Professor. I had to do this also in Kiswahili for wider dissemination. Thank you very much. Warmly welcome once again to Tanzania. And then I'm now ready to launch the report. Thank you.
All right. Well, thank you very much for your hands, and we'll launch if you would all stand at the high table. I know you've stood for a while as you were speaking, but the report is right in front of you. So may you please rise. Naomba tusimame katika meza kuu. And the pair of scissors is right there. Mheshimiwa Waziri, we've done this countless times. Maybe waandishi wa habari, naomba tafadhali nitoe hizo chupa za maji kama mtajali. We're just going to remove the tunaweza kuweka kwenye kona kabisa. Yes. All right, ladies and gentlemen, to launch the Lancet Oncology Commission report on cancer control in sub-Saharan Africa is the Honorable Minister of Health, United Republic of Tanzania, Honorable Umi Mwalimu. And scissor in hand, and all the concerned parties holding on to the report as she cuts the tape. Please put your hands together, ladies and gentlemen. And there it is. Launched in hand, and as usual we will spread that around. We'll take a copy to the left and right, to the left and the right. Professor, okay, we'll start with the professor, pass along all the way to WHO, Honorable Minister of Health, Zanzibar. Oh yes. Oh, and we also have Excellency from South Sudan. May you please come forward and please join us at the high table. So I think we have enough copies, perhaps. Professor Karibun. All right, we'll just slot ourselves in between the chairs. I think the Excellency from South Sudan, if you would move towards the middle, you might actually appear in the picture as they will not miss the minister. Piga picha, subirini katibu mkuu ajiunge kwenye picha. Now this is the picture now. All right, ladies and gentlemen, your hands once again. The report is launched. The highlights are coming in session number 2. And we'll ask the high table to sit, but the dignitaries that join the high table, please remain behind the chairs. Your Excellencies, please take a picture with you immediately. All right, so I'll be calling different groups for the photo. We're beginning with our Excellencies from Rwanda, Uganda, and South Sudan. Good to have you in the room. The CMO, wakurugenzi, program managers, and all workers from the Ministry of Health, you're on next. Your Excellencies, thank you very much for the opportunity. Karibuni sana. The Chief Medical Officer, directors, program managers, and all workers from Ministry of Health, please join the Honorable Minister in the high table for a group photo at the back. Karibuni. The Ocean Road Executive, management and staff, please stand by for the next picture. Let's put our hands together to the team. Congratulations. You know you've got a job in your hands with the launch. Now from Ocean Road, Karibu-san, management and staff. That's a big group. Will we all fit? Some of you can come all the way here to the edges on other side. Wengine hapa tu. Let's put our hands together to Ocean Road management and team. We were here over the weekend getting ready for this. Directors from institutions. We have Muhas. All the directors from the various institutions. Nimri from Bugando, ORCI, Mwembili, and all the others who are present, Karibuni sana. I'm probably also asking for the heads of institutions, universities. Please join this picture. And you can always adjust further to the left. So do I have everyone here? Wakuu wa vyuo na taasisi, heads of institutions, universities, colleges. We also have NGOs, CSOs, and so forth. All our implementing and development partners, please come forward for a picture. Karibuni sana. Did I get all the commissioners in one picture? I didn't, eh? All right, so please stand by for that one. So please, the commissioners, please, could you rise wherever you are? And we also have our final picture with our sponsors. All the commissioners, please, one picture. Marlo, please stand by. We have not only entertainment, but we also have infotainment from an artist called Marlo. And so the commission, all our commissioners, please. And all our